Hello everyone, this episode of Turning Up Clean Energy in Asia will sound a bit different. That's because it's not exactly about proving a high return on investment. It's about highlighting how positive changes in one of the critical global systems, the energy system, helps make the world better for people, nature and climate. My name is Shivani Shah, your host for today's episode. I can't wait to share how WRI India partnered with HSBC and development partners in the health sector to build renewable energy and storage solutions for rural health facilities in the three states of Jharkhand, Maharashtra, and Assam. This CSP project brings together multiple stakeholders who steer private philanthropic finance towards building a better world that runs on renewable energy. Powering healthcare is extremely precarious in rural India. Several thousand health sub-centers and public health centers, which are often the first point of contact for communities seeking basic healthcare, do not have reliable electricity services. In today's post-COVID-19 world, where telemedicine access is just as important as regular life-saving healthcare services, electricity is everything. To help us understand the connection between energy and healthcare, we are joined by Lanvin Concessao, Program Manager at WRI India, and Dr. Rajni Gupta, Program Manager at CHAI. Dr. Rajni, what are some of the challenges to delivering healthcare in rural regions?
Thank you, Shivani, for having me on this platform. First of all, the CHAI, that is Catholic Health Association of India, is an 80-year-old non-profit organization. It is predominantly managed by Catholic sisters, and 80% of the member institutions are located in remote and unreached areas. We provide the low-cost free health services to marginalized tribal population and to the low-income groups. We have a membership of over 3,500 healthcare institutions and social service societies. Out of these, around 2,000 healthcare center is located in the remote areas, and 600 around are located in the secondary and tertiary hospital in the small towns. And apart from this, CHAI network has care and support centers also for the people living with HIV, children, youth with disabilities, and also for the palliative support. So we have the major challenge is the availability of a qualified doctor in the hard to reach areas or tribal belt. So the telemedicine services by the CHAI has come as a boon for us, where getting a qualified doctor is a major challenge, and especially the specialist doctor. So this has helped us in a big way. The next significant challenge what we have faced is the power cut or voltage fluctuation or erratic supply of electricity. So they are dependent on the diesel generators or the dirty fuels and degrading the environment through carbon emissions. So these are the major challenge which we face in the healthcare in the rural areas. We have a few hospitals like Bharat Mata Health Center in Jharkhand, which they used to conduct deliveries in candlelight due to absence of electricity. Even in Gadchiroli, which is in Maharashtra at the tribal belt, again, that is Assisi Seva Sadar, they caters almost 150 patients daily, but they face nearly 7 hours of power cut. So these are the challenges which was after integrated clean energy solution able to provide their essential services round the clock, and they are able to upgrade their health services.
Thank you, Dr. Rajni, for that. Lanvin, my question to you is, what is the problem with accessing electricity in rural India? Why is it so difficult to get 24/7 power at health facilities?
Right. Yeah. Thanks, Shivani. So in India, we've had universal electrification schemes before, such as the Saubhagya scheme in 2017, which actually looked at electrifying all households in India. And so by 2019, the government actually declared nearly universal household electrification for all willing households, which is a significant achievement. But we're yet to see the same level of progress actually in social institutions, be it schools or health facilities, which are equally crucial for socioeconomic development. So taking health facilities as an example, but the rural health statistics in a report in 2022 by the Ministry of Health and Family Welfare, actually mentioned that there are nearly 18,000 sub-centers and primary health centers, which actually form the base and the first point of contact for communities in rural health systems, right? So nearly 18,000 of these facilities lacked access to an electricity connection. Moreover, this does not even cover the data or access to electricity of not-for-profit or charitable institutions like Chai, and where Dr. Rajni mentioned there are 3,500 of those. Nor does it actually cover which facilities have unreliable access to grid electricity in these areas. And the situation globally, of course, is even more stark, right? A report last year titled Energizing Health by WHO and various partners estimated that nearly 1 billion people across the world access healthcare facilities which are either unelectrified or do not have reliable electricity. And so, 1 billion people is huge, right? If that number were a country, it would be the third largest country in the world, to put things into perspective. And really, COVID-19, the pandemic really helped bring spotlight on this challenge of reliable electricity, especially for critical medical services, which were, crucial during COVID, such as oxygen production, vaccine cold chains, and ventilators. Many areas where the grid is unreliable, these health facilities have to rely on expensive and polluting diesel generators, which is, their main source of power backup. The challenge is still huge. And I think there are, of course, different solutions which are coming along the way for those.
Thanks for that, Lanvin. So just based off what Lanvin said, Dr. Rajni, how does adopting clean energy improve delivery of healthcare?
With the Green Energy Project, we have been able to install 238 kilowatt power solar in 26 health facilities in 3 states, that is Assam, Jharkhand and Maharashtra. That helps us to improve access to reliable power for non-polluting source and turned the reliance on the grid electricity and diesel generator. The uninterrupted supply of electricity in the health facilities have equipped them to run 24/7 and reduce the electricity bills. Those savings have used for upgradation of their existing facilities. Like we have hospitals in Karimganj and Assam. They don't have the electricity power. Even they don't have mobile and internet connectivity. Network connectivity is so poor. So adopting the green and clean energies, we are able to utilize them to run 24/7. Even in the night, the visibility is so low that patient cannot locate the hospital also. Recently, we have seen the Raymond cyclone. That time also, our Assam was affected a lot because of the cyclone, but our hospitals were running fine and they were giving the services seamlessly. Mary Mata Nursing Home in Kokrajhar is utilizing oxygen generator and nebulization services. St. Ursula Hospital is there in Jharkhand. They have upgraded their laboratory services and providing the baby warmers. So this is giving a greater boost to healthcare by adopting a clean energy.
And how have healthcare providers, that's doctors, nurses, and patients, sort of benefited from this project?
The solar project actually helped to serve more than 4 lakh patients in our health institution. And during this summer, scorching summer during this year, even with the temperature crossed 50 degrees centigrade, most of the places, the medical staff in our health centers were working seamlessly without any discomfort because of the presence of solar power in those centers. And the best example was I have that where the delivery was conducted in the Bharat Mata hospital in the candlelight. Now they are doing the deliveries and they are taking the patient in the night also. So they can run 24/7. They have the increased number of OPD and the staff has also increased in the hospital.
Lanvin, how has this project addressed those electricity issues you pointed out? Why do you think solar stands out as the way to bring reliable energy or power to these facilities?
Solar power has been used as the primary source of power in both rural, public, as well as not-for-profit health facilities in India. Our partners in both these different sectors have already solarized over 3,000 rural health facilities, in the past few years. And there are several commitments in India and globally to solarize many more health facilities this way by 2030. And there's a reason why it has gained so much traction, right? Solar solutions, especially with battery backup, provide a reliable source of electricity to different critical loads in the health facilities, right from your lights and fans to cold chain for vaccines and medicines, maternal and child care services, and even in many cases to water pumps, which is a very essential requirement. They also help reduce the reliance on diesel generators, and at the same time can also reduce the electricity bills by shifting many of these medical and non-medical applications to solar power. So you're not just benefiting from, say, a backup source which your diesel was previously targeting, but you're actually also reducing your normal electricity bills, which comes as a huge cost saving. And another benefit is also that it's a modular source of power, right? So which means that if there is space on your rooftop or in the facility, you can always add more solar panels and expand the power source as well in the future. It is flexible, it is it has been a reliable source of power, and it's of course sustainable. And to of course understand some of these impacts on solar energy and healthcare service delivery, we had the opportunity to partner with CHAI as well as HSBC India to integrate these clean energy solutions in rural and remote health facilities across Assam, Jharkhand and Maharashtra. So here we're not only looking at integrating solar and batteries, but actually looking at the need for robust procurement standards, sustainable operations, and maintenance practices, as well as measuring the impact of our interventions on healthcare service delivery, as well as looking at decarbonizing the healthcare system.
Thank you for that, Lanvin. That was very useful. Dr. Rajni, what are the next steps for the project, and how do you see this expanding?
So I feel there is a tremendous need for sustainable energy in chai. When I talk about chai, only 7% of facilities are solarized so far out of 3,500 member institutions we have on board. So learning from this commissioning and maintenance of solar projects will help us to scale our work in other health institutions, especially to the other social health facilities supporting communities like rehabilitation center, de-addiction centers, palliative care, which has a huge scope to be solarized. So I feel that is a bigger impact we can create there by solarizing those institutions.
Lanvin?
This project's given us a lot of learnings, starting from finding the right fit of health facilities and their energy needs to designing better procurement processes, building sustainability through, robust operations and maintenance, and also, measuring, monitoring and reporting of these project outcomes. So it's very relevant for us to actually, not just capture, but distill these learnings and make them available for a wider audience, not just in India, but also in other countries where they can possibly learn from this experience. I understand the context may be a bit different, but it helps to make sure that they're not reinventing the same processes or facing the same challenges that we may have faced in the earlier years of this project. And at the same time, it's important for us to also see how we can build capacity of other networks of not-for-profit hospitals or public health institutions on how they can actually approach electrification of health facilities using clean, affordable, and reliable energy.
Thank you, Dr. Rajni. Thank you, Lanvin, for taking the time and sharing your insights. It was extremely useful to understand how the project is actually helping overcome the various challenges related to electrification in remote locations in India. And like you said, Lanvin, we are hopeful that these learnings will be useful not only across India, but across different parts of the world that continue to face similar challenges on electrification of healthcare facilities. So we just heard from Lanvin and Dr. Rajni on this project. Let's get deeper into how this project was delivered from a technology and a financial perspective. Joining us to talk about the impact of reliable energy on healthcare services are Romit Sen, Senior Vice President, Corporate Sustainability at HSBC India, and WRI India's Rishikesh Mishra, Senior Program Associate with the Energy Program. I'll start with you, Rishikesh. Can you tell me how did you design the project for different health facilities?
First, that was to conduct detailed energy audits with our selected healthcare facility partners to understand the specific energy needs of each facility. This is crucial as we recognize that one size doesn't fit all. This includes several key steps while designing these projects. I'll break down it in 11 steps, and those were A, need assessment, B, site survey and feasibility study, C, system sizing, System sizing basically means estimating solar panels that needs to be installed based on energy uses and sunlight availability. D was technical designing of the system. So technical designing means determining the required solar capacity based on energy demand and ensuring the battery systems can provide power during outages. Also importantly, choosing high quality solar panels and inverters and batteries with sufficient capacity, its types and lifespan. E will be installing and commissioning. F, developing an operation maintenance plan. G, integrating the remote monitoring system, or as we say, RMS, to the solar plant. So remote monitoring systems are basically cloud-based IoT systems for monitoring the performance of one solar plant remotely. For example, if I'm currently in my Mumbai office, I can monitor the plant status in Assam and address any issues through error codes and alarms. H was integration with grid for optional battery charging. I was safety components for during the overall installations. J was also to record keep the important aspects of the whole project that we developed different kinds of format for this. And K will be finally training facility staff, local stakeholders from the healthcare facilities, including electricians, admins, nurses, support staff. So various capacity building sessions on various aspects of the project, including using workshops, online meeting, mobile communication through WhatsApp group, etc. Also, to understand how critical it is to design a sufficient system for a facility, here is an example. At Jyotinivas dispensary in Vani, Maharashtra, which faces extreme power availability issues. Last year, we installed a 5 kilowatt solar plant with around 18 kilowatt hour of battery energy storage under this project. This facility is the only dispensary within 15-kilometer radius and faces significant power availability issues. So for instance, last November, there was like 15-20 days of power interruption due to road constructions. However, with the solar installations, 24/7 electricity was ensured, allowing uninterrupted operation of critical medical services like nebulizations, which were previously unreliable due to power issues.
Thank you for that, Rishikesh. I have one more question for you, given the number of challenges you've just laid out. And that is, can you tell me what kind of challenges that came by while constructing clean energy solutions?
Sure. First one was logistical challenges. Those were significant, especially in remote locations where transporting equipments were difficult. Local workforce and site accessibility was also difficult. And to address these issues, working with local organizations proved beneficial for better logistics solutions. For example, in rural areas of Assam, utilizing local transport and community member support helped overcome these challenges, ensuring timely and efficient delivery and completion of the project. Second was, I'd say, technical complexities with the sizes of the facilities because they varied, ranging from, let's say, 4-bedded to 150-bedded facilities. Integrating solar system with existing electrical infrastructure was managed by drawing on experience from the previous installations and following strict procurement standards. We ensured compatibility with the existing systems by conducting thorough assessments and designing custom solutions for each facilities. For instance, at a health center, local electricians helped vendor integrate the new solar setup with pre-existing wirings during installations and commissioning, avoiding any cross connections and preventing disruption of the facility operations. So third, or the last one I'll say, was going forward after installation and commissioning. There are challenges on O&M, operation maintenance, which we saw during our initial part of the project. So concrete plan in place for operation maintenance were ensured through remote monitoring systems, integration, and extensive capacity building that allowed for real-time tracking of system performance and immediate response to any issues. The RMS also provided data on energy production, battery status, and system efficiency, enabling proactive maintenance and minimizing the downtime. Although there were challenges with RMS integration in the early stage of the project, it has now become an integral part of our projects. So by leveraging local partnerships, expert engineering, and IoT or RMS, we effectively overcame logistical and technical challenges, thus ensuring the success and sustainability of these DRE solar projects.
Thank you, Rishikesh.
for listing out a number of challenges and the detailed execution that you sort of ensured at these facilities. I have a question for you, Romit. As the CSP funder, what is HSBC India's strategy on energy transition?
Shivani, as you said, the engagement with WRI is part of our Global Climate Solutions Partnership Program. But in India, the approach that we have followed is to look at energy transition from a sectoral point of view. For example, with WRI, we are engaged with energy transition in the healthcare sector. There are other initiatives that we have on energy transition, focusing at sectors such as dairy cold chain, such as productive use of energy, such as water purification treatment and wastewater treatment. Because our philosophy here is that it's an opportune time to look at renewable energy solutions in the country because, one, the government has a strong commitment to enhance renewable energy access. But more importantly, we see energy as a critical lever to generate development outcomes for bottom of the pyramid population. And this partnership with WRI kind of demonstrate the approach of how access to clean energy can create large scale development outcomes for our communities and people.
Thank you, Romit. You mentioned you're taking a sectoral approach, and I was wondering if you can talk a little bit to how does decarbonizing healthcare fit into your larger strategy?
In India also, we have to look at it from the point of view of corporate social responsibility, where healthcare is a basic tenet of life. You need, health services for overall growth, development, and well-being of an individual and on a community. We are also aware that in areas, not only rural, but even in peri-urban areas and in some of towns and cities, lack of an assured supply of energy has an impact on the overall status of how services are administered and delivered to a large section of the population. That is where this engagement came through, and that is where our approach and partnership of working with WRI to look at renewable energy solution which will provide an assured and reliable source of clean energy for our healthcare facilities. So it's a win-win both in terms of the environmental side of it, because instead of using diesel genset and instead of relying on sources of fuels or energy that are more polluting, one, you have access to a cleaner fuel which is more reliable and safe, and secondly, the access to energy which we have seen, data from the project has indicated the whole transformational aspect that access to clean energy has made, whether it is in terms of sheer number of patients who are availing health facilities in these hospitals, or how we've been able to better the quality of service, whether it is access to vaccination, operations, delivery, pathological test. So this whole approach of looking at improving the efficiency, delivery, and services of the healthcare sector through energy access, which is a critical lever, is perhaps a biggest win. And we are very happy that this approach has kind of, through the work that WRI India has done here, is being able to mainstream within the larger public policy discourse.
Thank you. That was quite insightful. I do have a question based on what you just said to you and to Rishikesh. And that is, if you could just elaborate more specifically how reliable energy improves the delivery of health care. You can start.
Yes, and I think we began this initiative in 2020, and that was the time when the COVID pandemic was ongoing. And as you realize, it was a time when there was a great need. The government had started the vaccination for COVID, but we realized that in the absence of refrigeration facilities, a large part of the COVID vaccines was going to waste, and it was not able to kind of create an impact. More importantly, it couldn't reach to the people. Impact is secondary, but just that wastage meant that a large section of population would have been deprived of the vaccines for COVID, which had ramifications on the health, well-being, survival, livelihood, everything. And that is where this intervention, the whole approach of energy access plays such an important part, that access to energy was able to provide refrigeration facilities for vaccination, which at that time was critical and life saving. So that's my reflection, basis the genesis. And of course there are other examples on how vaccine storage has improved, pathological tests has improved, other services have improved. But I'll pass it on to Rishikesh, because I'm sure he'll have much more evidence from his work on the ground. Rishikesh, over to you.
Doctors and nurses have shared during various meetings and workshops also how the integration of reliable energy, especially solar powered plant with battery backup, has transformed their ability to provide consistent healthcare services. The introduction of reliable solar energy systems have enabled these facilities to operate round the clock, improving outpatient care, handling more institutional deliveries, and accepting more inpatients. The stable energy supply ensures the proper functioning of critical medical devices, provide comfortable environment with adequate lighting and cooling, and support continuous service such as emergency care, surgeries, use essential medical equipments like nebulizers, oxygen concentrators, and diagnostic equipments. Some facilities even have expanded their services to include few more laboratory tests, which were previously unattainable. This transformation has significantly improved healthcare delivery in these communities, allowing healthcare center to fulfill their missions of serving the local population more effectively.
Thank you for that, Rishikesh. You've worked for quite some time on this project, and I'm wondering if you could share what do you consider as some of the big wins in the past 3 years, and how can these successes scale health facility electrification in a sustainable manner?
One of our significant achievements has been the implementation of remote monitoring systems with the solar plants. The system enables us to collect comprehensive data on energy generation, ensuring that the systems are operational and efficient. Another examples are transition from lead acid to maintenance-free VRLA gel batteries in Assam. Our project evolved from using polycrystalline solar panels of 330 watt peak in the first project to the use of higher efficiency 550 watt peak monopuck solar panels in the latest one. These have improved power output while requiring less space, enhancing overall project sustainability and efficiency. Second was building capacity of few hundreds of healthcare staffs. Something that gives us the most satisfaction is the capacity building and the system training done at these facilities. Also, while considering all this, we have seen a considerable cost savings on energy charges by the solar plants. We have installed around 238 kilowatt peak and close to 1 megawatt hour of energy storage for the solar plants. These initiatives have served around more than zero point 0.4 million people and also resulted in savings exceeding more than 0.7 million in Indian currency. And lastly, how do I see these learning to help expand works? So based on our experiences working in various remote locations and numerous healthcare facilities in the most climate vulnerable areas, implementing these DREs solutions using advanced technologies for healthcare facilities can significantly address critical issues of enhancing reliable 24 into 7 electricity for healthcare services, including energy efficiency, not just looking at the energy supply, but also optimizing energy demand. I think all of this regions and countries should consider tailored DRE solution for healthcare facilities to help meet their developmental goals.
Romit, I have one last question for you, and that is, as the project moves into the next phase, how do you see it enabling and scaling even more financing towards India's health goals as well as the country's energy transition?
That's a very good question, Shivani, because I think we realize that for a country which is as large and diverse as in India, for things to happen at scale, philanthropy can help demonstrate a solution, which this project has done. But to be able to scale it and make a transformational impact in this country, we need finance, both public and private sector. While we looked at energy access, our current intervention during this year and our vision for the coming years is to look at the whole approach of net zero healthcare, which in addition to access will also look at energy efficiency, will look at metering. Coming to the point of financing, so I think we all are aware that in India, and for it's true for the case of developing economies, a large part of the finance is public sector. In India, 92% of the development finance is public sector finance. So the remaining 8% is, of course, philanthropy, CSR, private sector, multilateral, bilateral. The WRI team has done an incredible amount of work to first build a case for energy solutions in healthcare and then mainstreaming it in the guidelines of the National Health Mission, because that is the major, public sector program around healthcare. And I am aware, based on my conversations with the WRI team and officials of NHM, when WRI got them together in their annual India conclave, NHM is now looking at supporting renewable energy solutions for healthcare infrastructure under NHM. On the private sector finance side of it, I think this is still work in progress, because once this case is demonstrated here, we would like to take it to not only philanthropies but also commercial financing, because the project has kind of demonstrated the models in terms of developing the right kind of RFPs or tenders for solar installations. It has also helped in customization, the point that Rishikesh also touched upon around the specific needs. A one size fit approach doesn't work. So with the learnings, and this project has also engaged with a large amount of the service providers, the manufacturers and others. So I think we will now have to work on to build a case on financing for the private sector, because where the commercial angle will kind of gain a little bit predominance. That is something that I'm hoping we'll be able to pick it up from our work with WRI this year and subsequently, which of course will again then demonstrate the commercial or the business case for private financing to come and support renewable energy solutions in healthcare.
Thank you, Romit. Thank you, Romit and Rishikesh, for your time. And we're looking forward to how this project can create sustainable finance solutions for improving energy access in the health sector.
Thanks for having me, Shivani.
Thank you for having me, Shivani.
We hope that we made the connection between energy and health as clear as day. Next time, we'll show you how WRI helps leading corporations to decarbonize their supply chains in China. That does it for this edition of Turning Up Clean Energy in Asia, a podcast series produced and edited by Daniel Baker with funding from the Climate Solutions Partnership. The CSP is a 5-year partnership between WRI, WWF, and financed by HSBC with a focus on nature-based solutions and accelerating clean energy transition in Southeast Asia. You can learn more about this work and hear the other episodes in the series on our website, that is wri.org/podcasts. Thank you to our guests who made this episode possible. For my colleagues at WRI, my name is Shivani Shah. Don't forget to leave us a 5-star rating on whatever podcast platform you listened to this episode on. Every review counts. Thanks for listening.